I'm Corinne Burnett, and I'm a primary therapist here at Maryland Addiction Recovery Center. Intensive outpatient, or IOP treatment, is an outpatient level of care for members of local communities suffering from addiction, substance use disorders, and co-occurring disorders. This can be a great option for patients who are living at home or in a local recovery house. IOP can be used following residential treatment as aftercare, or for those individuals who are looking for treatment and support but aren't able to or need to participate in inpatient treatment. Here at MARC, we have two IOP programs, our daytime program and our evening program. The daytime program is usually for those people leaving residential treatment or for young adults who aren't yet employed in a career. Our evening program here typically sees working professionals that have a 9-to-5 career and are attending in the evenings after work. Both of our IOP programs are comprehensive and process-oriented, so patients can work through the core issues that fuel addictive behavior. We offer group therapy 5 days a week for morning IOP and 3 nights a week for evening IOP. Every patient receives a master's level primary therapist and we'll meet with them weekly for individual sessions. They're also assigned to a caseload of one of our psychiatrists, who will meet with them as much as needed to handle any mental health issues that require medication. Finally, we have a large family component. Family members and loved ones are engaged immediately once a patient admits, and they work with the primary therapist and the family therapist throughout the patient's treatment. We know that addiction in the family causes issues and ongoing trauma for the family unit, so we do as much family work as possible to help the entire family recover. We do joint therapy sessions with patients and their families, as well as sometimes just meeting with the family members themselves. We'll have regular phone calls throughout the patient's time at MARC to update the family on the patient's progress, but also to support them in the process, answer questions, and help them hold boundaries to find healthy ways to support their loved one. While a patient's at MARC, we make sure to work with any other entity that might be involved in their treatment. This can include lawyers, employers, EAPs or probation officers, as well as referral sources like outside therapists, interventionists, or previous treatment facilities. We believe that when communication, information, and transparency is involved between all parties, we can best support the patient's journey in health and recovery. It really is an "it takes a village" mindset. The more we collaborate with everyone sharing the goal of recovery, the more likely the patient will be to find and stay in recovery.